dear students. So today topic of discussion is appendicitis. Before that I will discuss few points related to appendix. So appendix is a 3 to 10 centimeter long, 3 to 10 centimeter long, but it can be even long as 10 to 30 centimeter. So it varies from person to person. It is not fixed criteria. The length is not fixed in appendix, and it is situated 2 centimeter posterior medially to iliocacal junction. So appendix is 3 to 10 centimeter long, but it can vary from person to person. It could be 3 centimeter to 30 centimeter long, and it is situated 2 centimeter posterior medially to iliocacal junction. The arterial supply is through the appendicular artery, which is a branch of ileocolic artery. Now this appendix has 3 layers. The first is serosa, then mucosa. Mucosa is covered by columnar epithelium. And this mucosa has longitudinal and circular muscle fibers. So it is formed of longitudinal and circular muscle fibers, and it is covered by columnar epithelium. Next to mucosa, the innermost layer is submucosa. So submucosa is rich in lymphoid follicles. Now just understand this properly. Why the young people almost get affected? Why the young people get appendicitis? उन्हीं को क्यों होता है young people को? Because this submucosa contains the lymphoid follicles, and as the age advances, this lymphoid tissue gets depleted, gets decreased, कम होता जाएगा lymphoid tissue. So in elderly and in old age people, appendicitis usually doesn't occur. It only affects young individuals. So this is the reason, because in young the submucosa is rich in lymphoid tissue. It has a lot of lymphoid follicles. Now appendicitis, that is the inflammation or the infection of the appendix. Now why this occurs? There are some causes. So etiological factors. So the factors are, first factor is racial and dietary factors. Racial and dietary factors. So it usually affects the white people more. White people are more affected compared to dark skin tone. Then dietary factors. The persons who consume more Western diet and who are consuming more meat. So meat increases the risk of appendicitis, and the fiber-rich diet, that is the diet containing cellulose, will protect the person from appendicitis. So the fiber-rich diet will protect the person from appendicitis. Then young individuals are affected. Young people, This I have already explained that why young people are affected, because the submucosa of the appendix contains lymphoid follicles, and as the age advances this lymphoid tissue gets decreased. So young people gets affected. Then socio-economic standard. Yes, this is very strange to hear, but this is true. Till now only rich or middle class people have been reported. Social economic standards. So it is also said, a funny thing is said, that only the rich people gets this disease. The reason is unknown. So it is a disease of rich people. Then beside the racial and dietary factors and socio-economic standards, the hereditary or the family susceptibility. That means the person having a long retrocacal appendix. Long retrocacal appendix. So the person having long retrocacal appendix, the blood supply will be diminished to the distal portion. So there will be not proper blood supply to the distal portion because the appendix is long retrocacal appendix. Then obstructive reasons or the obstructive causes. Obstructive causes are if there is cyst formation or there is ova, worm, cyst or fecolith. Then non-obstructive causes. Non-obstructive causes are when there is infections due to the bacteria like Klebsiella, Proteus, E. coli, Pseudomonas and other anaerobes, and yes, E. coli, Klebsiella, Proteus and Pseudomonas and other anaerobes. So the obstructive causes due to the ova, worm and fecoliths and cyst, and non-obstructive causes because of the bacterial infection. Then pathology. Now what happens in case of non-obstructive when there is infection? So there will be first mucosa affected and later on submucosa. So there will be inflammations and ulcer formations. There will be ulcer formation in submucosa. Later on the lymphoid tissue is affected. So what will happen? Perforation, ulcerations and necrosis, gangrene. So the ultimate result is gangrene. Now when the submuca is affected, there will be proliferation and invention. First the invention of bacteria will occur in lymphoid tissue and slowly they will form multiple secretions and will secrete the toxins, and there will be proliferation of the bacteria in the lymphoid tissue. Then in case of obstructive, because there is obstruction due to the cyst or due to the ova or the worms, so worm, cyst and ova will cause obstruction. So the obstruction and stasis will further cause contamination of contents and stasis. So the bacteria will grow over there, and because due to obstruction the contamination will occur fast and there will be proliferation of bacteria and perforation. Later there will be sepsis and local abscess will form, and that can also result to peritonitis or perforation and gangrene, or can lead to peritonitis. And because of this contamination of contents and obstruction, there will be increased tension there. So the bacteria will proliferate over that area and there will be septic and local abscess formation. So this was the pathology. Now why appendicitis is so dangerous? This may come in your question, why it is dangerous. Because first reason is appendix is closed at one end. So appendix is closed at one end. So what will happen? There will be obstruction. So easy obstruction can occur. And when the obstruction will occur, that will increase the tension and there will be formation of abscess and then can lead to peritonitis. Then second reason is appendicular artery is end artery. Appendicular artery is end artery. So that will cause perforation. Easily perforation. Easy perforation. Then third reason is appendix is devoid or lack of muscular cord. So easy can get perforated. So these are the reasons that appendix is devoid of muscular cord and appendicular artery is end artery. So gangrene can occur, easy perforation can occur, and appendix is closed at one end, so easily obstruction will occur. Also the lumen is very narrow. So lumen of the appendix is very narrow, so that can also result in early obstruction. Now signs and symptoms, the clinical features. First there is pain. So umbilical pain. Remember, this is visceral pain. There will be umbilical pain. Severe colically pain will be there, and this pain will shift within some hours or few hours to the right iliac fossa. So that will get shift. So that will get shift within few hours to right iliac fossa. And this is somatic pain. So first there will be pain in umbilical region, and within few hours it will get shift to right iliac fossa, because that will cause irritation of parietal peritoneum. There will be inflammation of parietal peritoneum. So because of the inflammation of parietal peritoneum, the pain will get shift to the right iliac fossa. Then second clinical feature is vomiting. Vomitings can be one or two because of the reflux pylospasm. Then constipation or diarrhea. This depends on person to person. So there could be constipation or diarrhea. Then hematuria. Hematuria occurs in advanced cases or in persons who are having a retrocacal appendix, a long retrocacal appendix. So that retrocacal electrocacal appendix will irritate ureter. So that long electrocacal appendix will irritate the ureter, and because of that irritation there will be blood in urine, that is hematuria. Then fever. If there is obstruction or that obstruction has led to the further proliferation of bacteria and perforation and gangrene, or the cause is due to the infections by Pseudomonas, Klebsiella, E. coli, protease or other anaerobes, so that will lead to fever with there will be obvious body aches, chills and rigors. So the intensity of infection will decide the grade of temperature along with the upcoming features, like accompanying features will be depending on the intensity of infection. So chills, rigors and intense body ache, muscle ache will be present in high grade infection.